Hi, Dr. Brandon Lair here with Health Quest Resistance Group, and this is 1 Minute to Better Health. This week I'm going to be talking about disc injuries specifically and how those commonly occur, and specifically the lower back. So what we're going to be looking at is what creates a disc injury in general, but first we got to talk about what is a disc. Okay? And a disc is essentially a cartilage of cushion, a suspension, a hydraulic that is positioned between each individual vertebra throughout your spine. Now they are smaller in the neck versus here in the lower back. They take a lot more weight in the lower back, so they have to be a little bit thicker, have a little bit more cushion or hydraulic. A disc is primarily made of cartilage, and they have rings throughout it called the annulus fibrosus. Those rings interhinge like a Chinese finger trap. And when there's weight put on them axially or in a vertical direction, they actually tighten. But when you twist, they actually loosen and lax, and that's where they have a chance to rip. On the inside of a disc, there's a hydraulic called a nucleus pulposus, mainly made of fluid, a little center to it made of fluid. That those annulus fibrosus, or those cartilage rings, protect. A main thing that creates a disc injury is when you put a little bit of flexion, a little bit of bending, and a twist to whatever you're doing. Okay? That right there is the bad combination that creates disc bulges, protrusions, and herniations. When you bring your spine forward like this, all that nuclear material, that fluid within the disc, shifts to the backside, puts pressure on the back of the disc. And when you twist, it provides basically the right scenario for those fibers to tear. That's what creates the bulge or the protrusion or the herniation in severe cases. Pain that we're looking for with those specific symptoms for a disc, we're looking for that pain to be traveling down the legs, specifically in the lower back. We're looking for it to be very sharp and very disabling within the lower back. It will affect your ability to get up from a seated position, to walk, to run, even getting out of bed in the morning first thing. Those are all things that are indicative that you could potentially have a disc injury. Here at Health Quest, we're very, very proficient at treating these type of injuries. If you know anybody or you yourself might be suffering from those conditions, don't hesitate to give us a call or contact us via Facebook. Like or share our video if you like what you're hearing, and take care, guys.